Gold participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Lactation. I'm chatting today with Dr. Sanja Prabhu and Dr. Prashant Gangal about their upcoming presentation titled Who Growth Charts? From Science to Implementation. So Sanjay and Prashant, we are happy to have you with us today. And I think to start with, we have Sanjay who's going to answer a couple of questions for us. So Sanjay, to start with, I'm wondering if you can just tell us what are your feelings about whether or not pediatricians and health services in your area are actually using growth charts, and do you find that they're using them effectively?
In India, from where I come, the use of growth charts is still picking up. Means we do have growth charts, but they are not being utilized in the manner in which they have to be actually used. They are just used to plot the child's weight, but unfortunately no corrective action is taken if the child is either underweight or overweight.
Okay, interesting. And what do you think is the biggest misunderstanding when it comes to growth charts?
The biggest misunderstanding even among pediatricians is that it is just a point to be marked on a chart, but the follow-up of these points, that how the child is growing, especially in the first 2 years of life, has a great relation with the child's growth further on in his life. So this aspect has been forgotten by most of the people, and somehow the weights are taken, they are marked, and the baby is said, the parents are said that this is the child's weight, and we'll see next time how much it grows. And no counseling is done as far as the nutrition is concerned, or picking up childhood diseases which are causing malnutrition or maybe obesity. Obesity in our country is relatively rare. Many of our children are malnourished as compared to being obese.
Okay, that's interesting. It's, even here in North America, I think we see a lot of the same thing where, when we do have doctors that are using the growth charts, like you say, they're just plotting a point on the chart and not really looking at it any further. So interesting to see that on both sides of the world. So, okay, so I think we're going to hear from Prashant now.
Hello. I'm Dr. Gangal.
Wonderful. Thank you for joining us. So I'm wondering if you could tell us a little bit about what the biggest change is that you've seen during your career. I know you've been, seeing babies for quite a number of years. So what's the biggest change that you've noticed?
When I started my practice 25 years back, everybody was scared to use growth charts, including myself, because if at all the child goes down on the growth charts, would I be able to explain it to the parents? So out of this fear, many people, many pediatricians were not using growth charts. But I have started using WHO growth standards for last about 10 years, and I am extremely happy. Even in health services, government has introduced growth charts which are based on WHO standards, and more people are using these growth charts because they are finding it useful. I am also seeing a lot of change in the weighing scales which were being used. Initially, everywhere we had Salter scales. Then we had some balance scales which were not recording the weight very accurately. And then now we have digital scales with 5 gram difference. So change in the use of scales, acceptability of growth charts is the biggest change I have seen.
Okay, that's interesting. Do you find that it's making a difference in terms of, how, whether or not issues are being caught with the children? You find that there's a change there now that the growth charts are being used more often?
Though growth charts are being used, still a widespread use needs to be introduced. People are learning to use growth charts and learning to interpret from growth charts, but still we need to cover a lot of ground before people really accept those charts, start understanding from it. And the purpose of our presentation is exactly this, to let people know that don't get scared to use growth standards, number one. Number two, WHO growth charts is something which has happened as a great change in pediatricians repertoire of counseling the mothers and families. So please use growth charts, start using WHO growth charts, and use growth charts as horoscope to understand child past, to counsel on the present, and advise in such a way, counsel in such a way that the mistakes don't get repeated in future.
Okay, wonderful. So could you just give us a little bit of a sneak peek into some of the things that you're going to cover during the presentation? Just a few little highlights.
We'll be introducing the growth charts. We'll be talking about the different types of growth charts like weight for age, height for age, weight for height. We are going to talk about how to define underweight, how to define stunting, wasting, and then looking at a few charts from our patients, how to interpret growth charts, and that will ultimately equip the delegates to start using the growth charts and to start interpreting them also. So we have packed the theory as well as the practical stuff.
Okay, that sounds wonderful, and I know I am really looking forward to your presentation. So thank you so much for joining us, and for our delegates who are listening, you will be able to hear much more from Dr. Prabhu and Dr. Gangal on their live presentation day, which is Tuesday, April 26th at 0300 UTC, so we look forward to seeing you then. Thanks for joining, everyone, and goodbye for now.